Good afternoon, everyone. Welcome to Patient Advocates Transforming Healthcare, or PATH, Tuesday Table Talk. I'm really excited today to welcome our guests, Susan Collier and Nikki Montgomery. Our topic today, policy, politics, and patient-family engagement, understanding the power principle. My guests today, as I mentioned, are Sue and Nikki, both of whom I've had the great pleasure of working with, serving with, and consider good friends as well. So I'm very appreciative for their time today. First, I'll introduce Sue to you. Sue is the Chief Engagement Officer for Patient-Centered Innovation. She is a servant leader dedicated to advancing partnerships with patients and families to improve quality and safety. As a nurse, healthcare executive, and experienced patient, family, and community advocate, she creates opportunities to educate, engage, and innovate. Her passion for patient-family engagement is fueled by her desire for a healthcare system that reflects patients and families as active and vital members of the healthcare team. Welcome, Sue. Nikki Montgomery is the Executive Director of Madvocator, sorry, Nikki, Educational and Healthcare Advocacy Training. Her experiences in healthcare communications and her role as a former educator and the parent of a child with complex healthcare and educational needs led to her patient advocacy work. Nikki currently serves on the board of directors for University Hospitals, Rainbow Babies and Children's Hospital, and on the Global Patient Family Advisory Council for the Barrel Institute, among other involvements. Thanks again, Nikki, for joining us. I just want to remind our viewers today that if you'd like to ask Nikki and Sue some questions during our conversation, please feel free to put those in the YouTube chat feature. You have to be signed into YouTube, though, to do so. So we look forward to receiving your questions and answers during our talk today. So wanted to do a bit of level setting and ground us in today's conversation around policy, politics, power, and engagement. And I wanted to frame our discussion today around the current environment. More so this collective sense of two things, I think, one of which is fatigue around what's happening in our current political and social environment, as well as dealing with a pandemic. Many of us also having some sense of that quarantine fatigue as a result of COVID. Also this, to put it mildly, but almost, have to say, dread about what's happening now, what's to come, whether that's the outcomes of our election, which happens in a few weeks and we already know many have already placed their votes, and knowing the importance of what this election means to us individually and collectively and as a nation, versus the typical feelings we may have around this time in the fall. Many of us enjoy that cooler, crisp weather, the leaves changing, the anticipation of a election and all the hope and promise it may bring. And all that positivity that you feel when you feel like there's a change coming and you feel confident that that change will serve the greater good. And so, the juxtaposition of those two feelings, the one we normally have and the one we currently have, I think is something we have to acknowledge, particularly in this conversation we're going to have today. And as we know, policy, politics, power, and patient-family engagement or public engagement in any realm really has an interconnectedness. There's an intersection and an interdependence of all those things, all of those components. And so when we have this discussion today, I think we cannot forget each of those depends on one another, and each of those has a different role. And whatever that role may look like, whatever that role may feel like, can impact us individually and collectively. And if we really look at patient-family engagement as a whole, patient-family engagement is a concept or a construct that really has brought in the voice of patients, families, caregivers, and communities into healthcare, a space where typically that was not the case. A partnership that's really been cemented by the importance and the acknowledgement of recognizing that engaging those whom we serve and partnering with those same communities, same patients, same families is really an essential component of really driving healthcare transformation and hopefully pushing the system to get to that place of equity and justice that we all seek. So today in our conversation, I'm hoping Sue and Nikki can reflect a little bit on this and share with us a little bit about what does this look like when we have that juxtaposition of policy, politics, engagement, and power? What does it feel like in practice and in those real world examples? And I'd love to hear your kind of reflections on that today as we begin this conversation. And I'll start with Sue.
Thank you, Hala. I think I'd like to start with going back to something that you just said, and it triggered a memory of a sermon I heard for this just lovely priest that was talking about kind of that binary sense of fear and dread with optimism and hope. And his sermon was essentially summarized by saying that uh, uh, fear is the root of hate, and hope is the root of love. And we can feel both of those feelings. We can feel fear and we can feel hope, but it has to do with the difference between hate and love. And I'm struck by how when we talk about the intersection of anything, doesn't always have to be an intersection of differences. It can be an intersection where we find the power and the glory of what happens when all of these pieces work together, and they can work together. So when we talk about policy, it's really about a course of action that's designed by groups. When we talk about politics, it's about making decisions in groups and having power relationships with individuals. And power itself is the capacity to influence. So when you think about them, each of the definitions of those terms have very critical overlapping elements, but the real power is how we use those overlapping elements and how we recognize that connection. So it's an opportunity, I think, right now in this space where we're feeling a combination of things. And I'm feeling what you just described a minute ago. I'm feeling this sense of fear because it's tied to not liking some of the things that I'm hearing and seeing in our world. But it's also at the same time I feel hope because I know that there is the capacity to show love in so many levels and in so many spaces. So that's kind of my initial reaction to what you just said. And I know, Nikki, you've got some beautiful thoughts, I'm sure, to share as well.
Oh, thank you, Sue. I love what you said about those intersections being places for change. And I think about people who identify at those intersections as well, being key people who should be involved in change because they're affected in many ways by the policies that are developed. Those intersections are really places to see where your impact is. And I think that's so important. And how we use our power in those spaces is important for patients, for families, for leaders, all of that, being able to join our power effectively and perspective take and learn from each other. So I love what you said about that space to me, that intersection is such an important place to be.
And in some ways, I love the fact that you said this is, really an opportunity for change. We have to start by thinking in our heads and our hearts and our hands that we can do something. And in fact, we must do something. So it's almost a sense of you really don't have a choice. You need to do something in order to tap into that change potential.
So, in that spirit of doing something that you both shared and reflected upon, for our audience today, which I'm sure may have healthcare leadership, community leadership, patient advocates, and advisors, so on and so forth, what does this look like in practice when we truly are embracing this balance, this equity, and this equality in this work, in this space of patient-family engagement. Could you maybe share, each of you, an example of what that looks like, or perhaps even an example of what it doesn't look like? And if you could also share a little bit, I want to dig a little deeper. When it is working, what does that feel like? And when it's not working, what does that feel like?
I can start. My background is in critical thinking. And one of the elements of critical thinking is being able to perspective take. And I think when my perspective has been considered, when my voice has been heard in a space, it feels very empowering. It feels like I'm being accepted in that space, like I'm wanted and expected in that space as well. There's nothing worse than feeling like you're the person in the room who wasn't expected to be there, like surprise. So I think it's really important to know that my presence is not only expected, but accepted, valued. And when I am part of the conversation, particularly when we're dealing with healthcare, I manage the care of my complex son. When I'm part of that conversation, I feel like my knowledge is valued. I feel like we're going to get the best outcomes because you're considering the knowledge I bring. And that to me builds trust. And I know one of the difficult things about living in that space of fear is trust, especially with healthcare, and especially for many populations that have been underserved, that have experienced the non-equitable side of healthcare. That trust is so important. So the conversation and the perspective taking and seeing who's missing from the table, all of that comes together in really being able to develop our critical thinking beyond the view we came in with and leaving with broader perspectives than we started with.
I love you said the word value several times, and I think to me, when I'm asked how do I feel or what does it look like, I'm using only two senses, and in some ways the feeling part is a combination of really thinking that I am going to make a difference, either because I persuaded someone to include a voice that's not at the table, or someone is asking the tough questions and I'm not the only voice asking those tough questions. So I imagine that there are times, Nikki, when you're in the room and you don't want to be the only one talking about the patient's voice or to presenting the patient's perspective. You want someone else to go, I'd asked someone the other day that, or I think we need to have more patients at the table. So to me, it really looks like this active acceleration of understanding and awareness that we're not complete when we don't have the patient at the table, figuratively and literally. And the other thing that it feels like it feels uncomfortable. And I know, Holly, you were saying, and I heard last week on Dennis's presentation, that we have to be okay with being uncomfortable. And it's uncomfortable because, unfortunately, it's still fresh and it's still new for so many environments, for so many settings, to have the voice of the patient not just in the room or at the table, but actually valued. So I'm okay with discomfort. I'm okay with conflict, even where there's a difference of view and opinion. And I think that is very difficult sometimes for leaders and for others in the room to cut through that discomfort and let the voice not just be heard but valued. And the next step is to see the change happen. That's what it looks like to me, is when change is happening.
I agree, Sue. And that discomfort means you're doing something different. It means you're not doing the thing you've always done and gotten comfortable with. And a lot of us as patients, when we enter those spaces, certainly feel the discomfort of doing something different. And it's okay for leaders to share that feeling, recognize that we are all experiencing that feeling as we create something new.
Yeah, absolutely. I think, Dennis even said last week, if you're not feeling uncomfortable, then you're doing something wrong. And I think that really resonated with me and many who watched our talk last week on the moral determinants of health. That really came through in his ending remarks. Now, I want to dig a little deeper into power and power dynamics and the power principles. And I think particularly now in this time where we're having a national conversation, and I should say an elevated national conversation around structural racism, racial injustice, inequities, including in healthcare. This notion, this concept of power is so incredibly important. And I know, at least, in many conversations I've had with colleagues or on projects, understanding how power dynamics influences this work is really key. And also understanding the necessity of having to make and share space for all, so that we truly can be impactful. We truly can get to a place of equity and equality. And so many people, struggle with, well, what's my role? What's my role here? Who am I? Where can I go? What can I lend my efforts to? I'm confused. I'm uncomfortable. I don't know. And I know you, Nikki and Sue and I yesterday had a beautiful conversation, and I talked about this concept of a bridge, and how so many people, particularly in positions of leadership, and particularly those whom may not fully understand the depth and breadth of what structural racism is, what racial injustice is, what it looks like, because perhaps that's not part of their lived experience. That there's opportunities there to serve as a bridge to others, to make those connections, to ensure those voices are heard. And then Nikki says, or you're a wall. And I think that just rang so true as we were talking, that, it goes back to that notion of, if you're not part of the solution, you're part of the problem. And so I wanted you guys to maybe reflect a little bit on, this role of a bridge, and what that looks like, what it could look like, and the importance of it, and perhaps what happens if you are a wall. How is that stemming progress? How is that stemming innovation? How is it really not serving the purpose of equity and equality in engagement work?
Well, I don't mind starting by saying, for me, as I think about the way families navigate healthcare, one of the things I try to do is teach families to navigate disparities and navigate bias. And when you think about navigating, you want to form a smooth path with no obstacles. And what you're navigating are the obstacles. So in a lot of cases, the professionals that we deal with are the obstacles, and they don't know they are. They're not trying to be an obstacle. But if I have to learn how to navigate you, you're in my path, and you are not actually facilitating my safe passage. So for me, I think if you are not actively working toward bridging gaps, actively working toward finding where those gaps might be and what people are experiencing who have a different experience than you, then you are inevitably becoming a wall for those people to navigate, because you're creating policies that don't include their perspectives. You're managing politics in a way that does not include their voices. So to me, that bridge or a wall, it's like an either or. I don't think you get to be both. I think that if you're not active toward one thing, you end up inevitably becoming the other.
Well, there's that action word again, which really, when we were talking about this yesterday, and now as I'm listening to you, Nikki, there's the sense that both a wall and a bridge are dealing with obstacles. So a wall is built literally to hide things or to divide things, because it's actual a physical obstacle that you're trying to cover something up, or you're trying to divide space. And a bridge is spanning an obstacle. So you recognize it's there. So to me, part of that, the magic in getting beyond that, and as a leader or as a provider, as a community, as a nation, we have to stop and say there are obstacles. Let's just go ahead and acknowledge that. And those obstacles have to be dealt with. So I can ask myself, if I'm not doing something, if I'm not acting in a way to expand my knowledge, my awareness, my skills, my competencies to overcome this obstacle, to bridge to span this obstacle, then I'm doing something to create a wall. And it's almost that simple. And we have to be willing to be uncomfortable and say, gosh, maybe I'm a wall because I'm not reading, I'm not listening, I'm not asking others questions, I'm not connecting people to help persuade or influence that there is an obstacle and we can do something about it. So it kind of gets back to admitting there's an obstacle and then doing something about it. And what you do makes you a wall or a bridge.
And I would also add that those obstacles can be life or death. So this is not child's play here. This is life or death. And when you hit the wrong wall, it could make all the difference in quality of life, length of life, particularly as I try to navigate the healthcare as a Black woman. I know what those stats are. I know what those disparities are. And I don't want to hit a wall that's going to result in, ruining my life, changing my life. So it's so important that leaders understand that there are multiple perspectives, and these perspectives can really be life-changing if they are not considered.
And that makes this discussion even more of a power issue because the power is in the hands of those that can break the walls down or create the bridges. And the power is lost when your energy is spent trying to overcome that obstacle instead of dealing with the challenge that you have.
Now's a good time for an amen.
Amen.
Yes.
Yes, certainly. Amen to that. So, in these last few minutes, I wanted to take the time to really try to share with our audience, where do you guys think, the biggest opportunities are in terms of bridging those gaps you both so eloquently shared, and really engaging everyone really in this discussion, because as we know, we talk about it in patient family engagement, how we do not represent a diversity of voices and lived experiences. And that has been a challenge, at least in my experience, over almost 10 years now that I've been in this work. And it's consistently an issue brought to the table. So where do you see those opportunities to really begin to bridge those gaps, encourage more bridges to be part of this work, and really address ultimately what we know to be true, that if we don't begin to build those bridges, then we will continue not to address policy or politics or patient family engagement or balance power. So I'd love to hear, just in these last few minutes, what opportunities do you think are there and we should really start looking at more closely?
Hala, for me, I think it's where those gatekeepers are to me. There are people who are screening patients to get them involved in advocacy work in a hospital setting, for example. What is their background? Are they actually learning and growing, like Sue said? Are they expanding their knowledge, and are they learning to be bridges? Because those gatekeepers are really segments where that voice can be missing, and they decide which voices need to be brought in. So for me, I've found that entry point can be a difficult, sticky spot. We all want patients and families who are, articulate and educated and talented and have lots of free time to give and all of that. But there are many people who might not fall into those definitions traditionally, who have a lot to offer. So the gatekeepers need to realize that and allow more voices in that are not the typical voices they might invite. To me, that's a really important first step.
I wrote an op-ed several years ago for the North Carolina Journal of Medicine, and it was on patient family engagement, and it said it's not how, it's who. And the essence was that you have to start with yourself. And I know this sounds almost, idealistic, but whoever's listening today or in the future, and whoever we talk to, I typically have a conversation first with what am I doing first? What am I not doing? And when I'm talking with someone else, I'm showing them what I'm doing or not doing. So it really becomes a process by which you're building support in every single conversation. So this is not, you just talk about it when you're sitting on a committee or at a board meeting, or I'm talking about it tonight at dinner, or I'm talking about it when I'm in a conversation with someone in my church, or I'm having this conversation when I'm discussing an issue with a national organization. We're doing a webinar. I hate to say it, but I do secret squirrel, and I just kind of get it in there. So you have to start with yourself and take advantage of every single opportunity. And then the bigger stuff becomes a bit more organized and intentional. But I do see progress when we chip away at it, every single opportunity with every single individual, starting with yourself.
Agreed. I mean, imagine the impact we could all have collectively if we start with ourselves and recognize the power we have within to make change and to be impactful. And I think that, to me, is so key. We have about a couple minutes left, and I would hate to end early because I love this conversation. So I just wanted to end by, quickly maybe reflecting on this. Some conversations I've had of late have been around, does this require a different type of advocacy? Does this really require activism? And I would love to kind of hear your thoughts on that, because, at least from my opinion, I think in the space of patient-family engagement, we are really having to now move into this very different role, which is activism, to really speak to all the issues we discussed today. And I think particularly around equity, racial justice, health equity, and breaking down structural racism, there is a level of activism that has to be part of that solution. And I'm wondering what your thoughts, both maybe in these last 2 minutes or so, around, that balance of advocacy and activism.
Hala, I think you're correct that it is active to build a bridge. It is active to tear down a wall. These things do require activism. It's not enough to just say we'd like things to change. The action is what creates that activism, I believe, and the action is going to be dismantling and rebuilding in a different way. That does require a different look at this, that it's not just, leadership for the sake of leadership, that it is leadership for the sake of creating what we know we should have, which is an equitable system that delivers consistent outcomes. And if it's not delivering consistent outcomes, it's up to all of us to participate in creating that excellence. So I do believe it requires some degree of activism that is different than what we've done in the past.
I'm struck by what you just said, though, in terms of what we've done differently in the past. And I think of activism in this context where we are trying to make it clear this is what we need to do differently. And whereas advocacy is we already kind of have made a statement and we're advocating for it. So to me, activism is really getting people to shift to say we can do better than what we're doing, and we can certainly change what's happening now. And then once we get to the point where the majority, and even a small minority if necessary, say this is how we need to do differently, this is how we need to demonstrate that racial injustice is not in any way where we want to be. So let's change that. Here's some things that we need to do. And then you have advocacy to reinforce and sustain. So I think that for patient engagement, the whole power dynamic is being really clear. We need to influence a large number of people to understand we aren't doing it well right now. So let's figure out here we have research now, we have evidence, we have examples. Here's some ways that we can do it and make progress and meet certain outcomes. And then where advocacy is sustaining it and maintaining it. So.
Well, thank you so much, Nikki and Sue. This has been a great conversation. I know we could probably talk all day. And I hope that we may have continued conversations in the future about this topic and others, because I think we will continue the discussions as we move forward. And to our audience, be the bridge. Be the bridge, be the change you want to be. And so I hope that this talk will inspire others to really understand the power they have within and the bridge they can and should be. Thank you again so much, Sue and Nikki, and thank you to our Path Tuesday Table Talk audience. We're here every Tuesday at 2 p.m. Eastern on YouTube. You can always go back and look at conversations and listen in on ones that you may not have been able to catch live. Next week, our conversation will be around dignity, respect, and equity in healthcare. So I hope our audience will join us. I'll ask for Sue and Nikki to just pause for a few seconds as we end our stream today. And to all of our audience, thank you so much for your support, and we hope to see you next week. Have a great day.